Hello, good afternoon or good morning, everyone. Thank you for joining this NDD monthly live product training this month, focusing on the EasyOne Air device. Again, thank you so much for joining. My name is Jamie Burgess, and I am a registered respiratory therapist and here with NDD. And I'm excited to walk through the basics of spirometry on the EasyOne Air today with everyone. All right, we'll get going here. So just like you saw in the description when you registered for this event, we're going to learn the the spirometry basics, starting with that entering of the basic patient data, how to coach a patient successfully through a spirometry test, understanding and how to interpret those quality messages, those feedback messages, not only that you get from trial to trial, but the session quality overall. Some tips and tricks on interpreting results, and then we will always reserve about 10 minutes at the end of the broadcast for a live Q&A with Respiratory Therapist, which today is me. All right, so please go ahead. If you have questions at any point during the webinar, please utilize either the chat or the question bar in your GoToWebinar toolbar. We will definitely take time to go through those at the end of the webinar, but you don't necessarily have to wait to the end to type in your question. If something comes up while I'm speaking, go ahead and pop it in there. We do have Joy and Bianca moderating today, so they're keeping an eye on those questions and the chat bar throughout the webinar, and then we will tackle those questions at the end. All right, I am going to go ahead and share my screen here to something that, if you're familiar with the EasyOne Air, is going to look very, very similar to your EasyOne Air screen. All right, so when you first power on your EasyOne Air device, if it's the first time you've ever powered it on, it will ask you a series of questions, such as setting the language, the predicted value sets, a few other things, but I'm going to show you, if you don't know the answers to those when you first take your product out of the box, there's always a place to come back in and adjust those parameters later. But once you're all set up, this is what the home screen of the device looks like. There are 5 primary tiles on this home screen, the largest being your facility's preferred test type. In this instance, we're going to be focusing on the FVC, or the forced vital capacity test. Underneath the More tab, you will see several other tests that the device is capable of performing. And there, when we go in to set that preferred test type, you'll see that there's a couple extra options in there as well. So whatever test you are doing the majority of, we would want to set that as our preferred test type so it's easily accessible right from the home screen. Down below, looking at that reports and patients tiles, I always say there's a couple of different ways to access the information. If we go into that reports tile, and this is a demonstration software, so I don't have actual tests plugged in here, but if we were to click on that reports tile, it's going to list the most recent test all the way back in chronological order. So if you're just needing to quickly recall a patient from the same day, or just to pull up the test that you just performed, going under the reports tab and viewing those in chronological order is a really easy way to do that. Another way to recall past patient tests is to go into this patients tab. This is obviously where we can add, delete, or edit patients, recalculate if maybe we made a mistake entering some of our patient demographics. But then we can also select a patient to view their history. So if you're searching for a patient that maybe you haven't done recently, this might be a better option to access those tests performed on the device. Before we get into the actual test, I do want to take a few minutes to highlight some things in the actual device settings. These are the most popular things that we get asked about, things that are most commonly adjusted by our customers. So I always want to take a few minutes just to go through so that you're comfortable setting up the device for the first time. So I'm going to go ahead and go underneath the Tools tab. You'll notice that there are a few things underneath that Tools tab that we're not going to go into a lot of detail today. One is the calibration check. So if you are a market segment that is required or has elected to do a periodic calibration verification, this would be where you would go in to do that. Underneath that little lowercase I for the device information, that will have your current firmware version, the serial number of your device. Those are good things to keep handy, just in case you do ever need to call into service and support. Those are a couple of questions that will be commonly asked on your device. But we're going to spend the most time in this settings tile. So I'm going to go ahead and click there. And we're going to primarily focus on the printout, the device settings, and the spirometry settings. So I'm going to start actually with the device setting. So this is anything that's specific to the device itself, such as the system language, the time and the date format, our units of measurement, our speaker volume, does the touchpad click when we poke around on it, screen brightness, screen timeout, things that are very device specific. Any of these settings can be adjusted to your preference at any time. All right, popping back to that settings menu, the second thing that we're going to look at is this print out menu. Now, this print out menu is specific to if we are printing directly from our EasyOne Air dock. So if this is connected to a printer and we are going to just print our reports directly from the device, this would be where we would come in and adjust those printouts. So I have mine set for an external printer. I'm selecting the 3 best trials, the 3 best curves. I want to see both the flow volume and the volume time loop. I have checked if you are a facility that does do calibration verification, always make sure that that check mark is checked so that it shows up, the date and time of that last calibration verification shows up on your tests. And then the header 1, 2, 3, 4, that's where you can put your facility's information into the device so that it does print on that letterhead of your spirometry reports. And again, this is only for if you are printing directly from the device. All right. The last settings tab that we're going to take a look at is the spirometry tab. And when I was talking about when you first set up the device, it asks you all sorts of different questions about where you're living in the world, what language you want the device to speak, and then starts asking you about spirometry standards, predicted values, interpretation standards, and you don't always know the answers to those questions when you first power on your device. So if you ever need to come in and adjust any of those settings, all of those are going to be located under the spirometry tile. So the first tab is the ATS or ERS spirometry standard. We, of course, recommend going with the newest standard, which is 2019. We do still have the 2005 standard available if your facility elects to remain in the 2005, or if you're an ongoing study that needs to remain in 2005, that is still an option. Below this is that preferred test type. This is where you can adjust what test is showing up in that primary test tile on your home screen. Down below that is the option for the device to beep during the maneuver. I always recommend, especially initially, leaving this setting on. This is where the device will start beeping really, really fast at the beginning of the maneuver and then get slower and slower and slower as the patient gets closer to that point of expiratory plateau where no more air is coming out of their lungs and we know it's about ready to end the trial for us. So again, I recommend leaving it on. I think it's a good auditory cue, not only for you as a coach, but for your patient as well. Below this, we have our predicted value sets, one for adults and one for pediatrics. Again, this is very preference. This is based on your preference. Obviously, the most popular are going to be for the US, that NHANES number 3, or globally, that GLI 2012. We do have a variety of other predicted value groups. So if you are working in an area with a very specific ethnic population or a specific people group that you know that there is a predicted value set that is catered especially to that people group, of course, work with your physicians, work with your providers, and see what's going to work best, because our predicted value set is how we determine what is normal for a patient of any given demographic. So we want to make sure that we are making the best choice for our patient population groups. Again, if you are testing pediatrics and want a specific pediatric predicted value set, you can select that here. System interpretation is down here below. As you can see, there are a few different options on here. And none is one of those options. So if your provider is not wanting the system to do an interpretation of your test results for the report, you can always select for there not to be in system interpretation as well. All right, below this is just kind of some housekeeping. Patient ID format. Is it numbers only? Is it alphanumerical? Graph selection, I always prefer to view both the volume time curve and the flow volume loop. I also do recommend showing the predicted range on your report. It's just a really good visual for not only you as the tech, but for your patients as well, to see where they fall within what is supposed to be normal for their patient population. Below this, the lung age calculation, again, you can turn this on or off where it will give a predicted lung age. Again, this is a good tool for patient education, just so that they can kind of, in terms that are very easy for them to understand, see where their lung health sits. All right. Okay, well, I am going to go ahead and pop back out to the home screen. So again, those parameters can be adjusted at any time. So if you have a provider who wants to come in and take a look at this device, especially if you're brand new, or, again, just start generating reports and see if there are things that need to be changed. All right. Okay, I am going to go ahead and stop sharing my screen for just a moment so that I show up a little bit larger on your screen. But I wanted to talk a little bit about how we prepare a patient for a spirometry test. And again, we don't always know that a patient is going to get spirometry when they come into the office or to the clinic. But there are certain things that we can do if we know that that's a possibility, just to prepare them. And your physician might have recommendations for holding certain medications, holding caffeine, not eating for a certain amount of time before the spirometry test, because it is a really, really demanding test. If you've ever done spirometry before, you know that this is not a natural way that people breathe. No one is going to just naturally know how to do this test, and it's really up to us to be able to teach them how to do it appropriately. Even very sick patients can do an acceptable and a reproducible spirometry test. I myself have asthma. My PFT results always show that I am mildly obstructed. I always have a little bit of scoop out on my curve, but I can still, even when I am ill, perform an appropriate, acceptable, reproducible spirometry test. But it does sometimes take a little bit extra effort, especially if a patient is acutely ill, to get those results that we need out of the patient. So we talked a little bit about things that your providers might want to relay to the patient, such as holding medications, not eating, making sure the patient hasn't had a recent abdominal or cranial surgery. But some other things to think about that maybe don't immediately come to mind is what your patient is wearing. A lot of times, again, we don't always know that we're going to do spirometry, but loosening belts and girdles, abdominal or chest binders, suspenders, neckties, really, really tight clothing that would prevent your patient from taking the biggest breath in possible and then blasting it out as hard and as fast as they can. We always want to make sure that our patients do have access to a stationary chair. Most patients are going to give you a better spirometry result when they are seated with good posture in a stationary chair. The ATS ERS doesn't give a preference on sitting versus standing. I always kind of tell the joke that if somebody has, a larger belly, pregnant women, they might find it easier to stand doing spirometry just because it gives them a little bit more space to breathe. I have done spirometry standing 3 different times in my life, and it was the 3 different times I was pregnant. My allergist had me stand. So again, be flexible, make sure that your patient is comfortable. Something else that we get a lot of questions about is actually dentures. And dentures, if they are well fitted and well secured in the patient's mouth, they can actually make a much better seal on the mouthpiece, leaving those dentures in place. But obviously, if the dentures are ill fitted, not well secured, we don't want them to end up on the floor when you have your patient blast out. So normally then it would make sense for them to take the dentures out and make a good tight seal without those in place. All right. I know I mentioned with the sitting and the standing, making sure that our patients are maintaining good posture during the test. And this is something that is very, very common. Always reminding a patient to sit up nice and tall, making sure that their chin is elevated off of their chest, because so many times when we tell a patient to take a deep breath in and blast it out as hard and as fast as they can, the first thing they do is they wad themselves up in a little ball. Because they think that that is going to help push that air out. And what it actually does really is essentially cuts off their airway or causes a glottic closure. So we want to make sure that during the entire maneuver, we're paying attention to not only what our patient is doing on the screen, but their overall posture, making sure that they are maintaining that chin off the chest posture during the entire exam. All right. Before we move into the actual test, we're going to talk about just some different supplies that we need to get started. So obviously we will need our EasyOne Air spirometer. This is the dock for the EasyOne Air. You'll notice in the back that there are two different ports. One is for the power to actually charge the device, and the other is where you can connect either directly to a printer or connect to your computer to utilize the EasyOne Connect software. All right. You'll need your single patient use flow tube mouthpiece. If your facility requires inline filter use for spirometry, you would need the EasyOne Filter FT for flow tube. So you'll see that the back is kind of shaped like a rectangle, just like the EasyOne flow tube. And then we do recommend nose clips for every patient. While we know that it's especially important if we are doing an inspiratory maneuver where patients could entrain some air into their nose, we do always want to make sure that we are capturing their full effort, discouraging them from taking extra breaths during the maneuver. So even for these expiratory maneuvers, it is recommended to have the patient plug their nose or to use nose clips. All right. So with the EasyOne Air, I always say it's a little bit fun to demonstrate this product virtually, just because a lot of times it is hard to get a perfect shot of the screen without producing a glare. So you'll notice that I'm going to kind of toggle back and forth from that demonstration software to doing the test live, and then also showing you what the test looks like in the EasyOne Connect software. So as I toggle through the screens, just be patient with me, just because I want to make sure that you guys do have a really good visual of what you should be seeing during a test. So I'm going to go ahead and pull that demonstration software back up here. All right, so now you should see the box with the 5 primary test tiles. So when we are preparing to test a patient, obviously the first thing we need to do is enter the patient into the device. And there's actually, again, all of these buttons are multiple ways to get to the same location. So there's a couple of different ways that we can enter the patient. So obviously underneath the Patients tab, we can click to add a new patient. Or if we click on the test tile, it's going to prompt us to select a patient that's already in the device. Or as you can see, this first tab is to add a new patient. The sequence of adding a patient is going through a series of screens. There are several things that are required. There are a couple of parameters that are optional, such as weight or COPD diagnosis, smoker status, asthma diagnosis. But all other fields we want to make sure are filled out to the best of our knowledge. So obviously we have first name, last name, patient ID. I'm just going to make one up for now. All right, date of birth. And again, this will be the date format preference that we set back in that tools menu. All right, sex at birth. That is some new verbiage, 2005 standards versus 2019. Height, I have mine set to feet and inches, but if you have metric selected in that utility, or excuse me, in the tools menu, yours would obviously say centimeters. Same thing, if you have kilos selected, it would say kilograms instead of pounds. All right, here's the screen for the ethnicity. If you are not factoring in ethnicity into your spirometry reports, you can always elect to click other as well. All right. When you click finish, it's going to kind of give you one last chance to review the patient data that you just entered prior to starting the test. You just want to double check that everything was entered correctly. And again, here are some of those optional fields down here at the bottom. The patient's weight, have they been diagnosed with asthma? Are they a smoker? Have they been diagnosed with COPD? Again, these are optional fields because they don't weigh into that predicted value, how we determine what is normal for a patient of any given population. But if this will help your provider, if they want to see it on the report, absolutely fill in that data just so that your provider has a full picture of the patient history. All right. If this was not demonstration software, at this point, I would click to start the test and it would launch me into the test. But this window is actually not connected to my Air device. So I'm going to again stop sharing my screen for just a moment. All right. When we teach our patients how to do a spirometry test, again, nobody breathes like this naturally. It's something that really must be taught and coached throughout the entire maneuver. I always say the spirometry lab or the pulmonary function lab is always kind of the loudest place in the hospital. You can always hear them yelling when you get off of the elevator. We want to make sure that our patients know that this is not a relaxed maneuver when we're talking about FVC or FVL. Those are forced maneuvers. And we want to make sure that we are getting the best patient effort in the fewest amount of trials. One thing that we can do to set the expectations for what to expect is so that they know right off the bat, they're going to have to do this the right way a minimum of 3 times. We have to have a minimum of 3 acceptable and reproducible maneuvers for the device to end the session for us, knowing that we have a good session quality grade, that each trial was acceptable, and that each trial was reproducible, meaning looks like the next, looks like the next, and looks like the next. So setting the expectation that they are going to have to do this correctly, and they are going to have to do it more than one time, a lot of times takes some of the frustration away from the patient from the beginning. So just setting that expectation for them, that it's not an easy test, and we do have to do it a few times to be able to be finished. I always instruct the patient to do the entire maneuver on the mouthpiece. Every single month when we do these live training webinars, we always have questions in the chat about, I prefer to have my patient tidal breathe before their maneuver. I prefer to have the patient take their big deep breath in, then make their seal and blast. There's no wrong way to do this. It is whatever works best for you as a coach and for your patient to be able to achieve the maneuver correctly. I teach the entire maneuver on the mouthpiece, and our whole team does here at NDD, just because we have found that that produces the least amount of errors, the least amount of confusion for our patients. They already have their good tight seal. We're not worried about leaks. We're not worried about a hesitation message because we have captured every bit of that blast. Most of you know that FEV1 is a really important parameter, how much they can get out in the first second of expiration. If we are fumbling trying to make a seal, sometimes we can fail to capture or miscapture that FEV1. So we want to make sure that their mouth is on the mouthpiece from the very beginning. Again, if you do it an alternate way, or if you have the titles, if you saw in the preferred test type, we have a couple options that allow the patient to normally breathe prior to the maneuver. Those are not wrong methods. It's just, again, after many years of doing these trainings, this is the way that we have found works best for our patients and causes the least amount of issues. All right, so we're gonna have the patient make a good tight seal on the mouthpiece with their teeth on the top and their tongue on the bottom. We're gonna have them take a big deep breath in and then immediately blast it out hard and fast as fast as they can. Birthday cake with 100 candles on it, blowing through the stickiest spider web, whatever we have to relay to our patients that they understand this is a hard and fast maneuver. We are going to encourage them to keep blowing and keep blowing and keep blowing until the device tells us to stop. The device will have us end the maneuver once the patient has reached that point of expiratory plateau, meaning no more air is coming out of their lungs. The patient is going to feel like they are out of breath long before they are out of breath. If you watch our volume time curve, we will see it begin to plateau out. As long as it is continuing to rise, we know that there is still air coming out of their lungs. And so a lot of times when I'm coaching, I will even tell the patient that there's still air coming out, there's still air coming out, keep blowing, because we really want to make sure that we capture that entire FVC, that forced vital capacity. With the 2019 standards for each individual trial, the FEV1, how much they get out in the first second, and the FVC, how much they get out overall, those are looked at independently and labeled either as acceptable, usable, or not usable. So we want to make sure that for both sides of the test, the first, second, and the total volume, that we are getting acceptable values, meaning the patient has blasted out hard and fast all the way to the point where they are completely empty. All right, to get the test set up, it's a little bit difficult to see on my screen here, Let's see if I can get the light to hit it. Oh, there we go. You'll see that there is a stamped arrow on the top side of your flow tube mouthpiece. That stamped arrow is going to line up with the arrow that is drawn onto the onto the device. When you insert the mouthpiece, let's see if I can get the angle right there. There we go. Those two arrows are going to be facing towards each other when the mouthpiece is inserted correctly. You want to make sure that the mouthpiece is all the way flush with the device. If it's popped out at all, you happen to have it in upside down, etc., it is going to give you an error that the flow tube has an insertion error. It's not inserted correctly. One additional thing to think of if you are using an inline filter. The inline filter does go on the back side of the device, the non-patient side. Be cautious when you put that filter in place. I even kind of always hold the mouthpiece on this side because sometimes when we push that filter on, it will pop out the mouthpiece just enough that we get an insertion error. And sometimes it takes us a little bit of time to understand exactly why we got an insertion error. All right. I did want to make a special note here. If you are using the EasyOne filter solution, I apologize. Our demonstration software has not been updated to reflect that filter change. So I'm going to show you guys where that is on the actual device here in just a moment, so that it does prompt you prior to every trial to select if you are using a filter or if you are not. All right. Once you are completely set up and ready to go, the patient has been entered into the system. You've had that last time to double check all of the patient information. Whenever you're ready, you can click to start the test. All right, I'm going to very quickly show you guys where this is located. So for the inline filter setup, we're going to click on Tools. We're going to click on Settings, and then we're going to click on Device. So you'll notice that there is a tab that was not on my screen, my demonstration screen. About halfway down, you'll see a setting for an inline filter. You would click on that and then select the EasyOne Filter FT. All that does is prompt the device to ask you prior to each test if you are using a filter or if you are not. Okay? All right. All right, so now we're ready to test. Again, I'm going to do a little bit of back and forth on my camera, going back to some slides, going back over to EasyOne Connect, just so that you guys can see exactly what I'm doing here on the screen. All right, so I have entered myself as a patient already on this device as well. I am having that last double check on my patient information, and then I'm going to click Start Test. The very first thing it's going to ask me, because I have inline filter use enabled, I'm trying to get the glare there, is if I am using a filter, yes or no. The next thing it is going to prompt me to do is to block the flow tube mouthpiece while that ultrasound sensor does a quick zero of itself. It's setting that baseline setting. Very commonly, people will leave the plastic on the front side of the mouthpiece during this test. You can use a gloved hand to the back, just as long as there's no air moving through the device during this quick set of baseline. So I'm going to go ahead and block the mouthpiece and click OK. All right, you'll see that self-test was very, very quick, and it is now giving me the instruction to blast out. I know that this is a little bit difficult to see, but I promise I will do it in some other ways where the data is a little bit easier to see. But this first time, we're going to just do it on the device. So teeth on top, tongue on bottom, big breath in, blast it out hard and as fast as you can until the device tells you to stop. All right, so between every single trial, it is going to give you feedback. Right now, it is telling me good effort, do next. And it's also giving me the session quality grade for both the FEV1 and the FVC. Don't be discouraged if after the first trial you have a green smiley face, but your letter grade is still like an E or a U. Remember, we have to have a minimum of 3 good trials. While the smiley face gives us feedback on the individual trials, the session quality is judging the session overall. So until we have a minimum of 3 good trials, we won't see that good A or a B grade. All right. I'm going to hop back over to my slideshow here for just a moment. All right, and we're going to talk a little bit about what these stoplight smileys mean. So the overall trial rating, so this is each individual trial is represented by these stoplight smileys, are green, yellow, and red. You can see examples of each down at the bottom of the screen. The green will indicate that both the FEV1 and the FVC are acceptable. They meet criteria, in other words. The yellow is both parameters are at least usable, but not both acceptable. The most common yellow smiley face that we will get is there is an acceptable FEV1 and an usable FVC. And this is so common because we are not having our patient continue to push air out until that point of expiratory plateau. So they take their big deep breath in, they blast it out hard and fast. Their FEV1, the amount they got out in the first second, is fantastic. But then they cut it short. They don't go all the way to the point of expiratory plateau. So we're not getting that full volume, that full expiratory volume, which is why the FVC is only usable. Again, that is a very, very common example of that yellow smiley face. And then obviously the red, at least one of those parameters, FEV1, FVC, is not usable at all. So that would not be a trial, that would not be an acceptable trial for one reason or the other. I personally do not recommend deleting trials just because, again, every given parameter has its own set of rules determining what is best about it. Even bad trials sometimes can have good parameters, any given parameter. So again, just continue to build trials until you get that session complete, great job, or you have reached the point either of patient exhaustion or if your facility has a maximum trials allowed in place. ATS and ERS says we can go up to 12 trials to get those acceptable, reproducible results. Again, nobody wants to go to 12 trials, but we know that we can continue to add trials until we get that message that the session is complete. On the EasyOne Air screen, if you were to click on either one, any one of those smiley faces, it will actually expand out into a really detailed quality breakdown, showing both for FEV1 and FVC, what was usable, what was not usable, or what was acceptable, what was usable, or what was not usable. All right, it also does give you some feedback, just showing, like in this example, we need to instruct the patient to exhale longer until completely empty. This looks like an example where the FEV1 was great, but we didn't make it all the way to plateau. All right, so again, this does give a very detailed pass-fail breakdown, and it also does give you suggestions to improve the next test. All right, and we'll hit on this again a little bit later as well. If you click to view the data between each trial, so there's two options to either add another trial or to view the data. You can see where your session quality grade sits wherever you are during the test. Again, we know that to get an A or a B, we're going to have to continue to add acceptable maneuvers. But this is really a detailed breakdown of what that grading scale looks like. So there really shouldn't be a mystery of why I have an E grade, so to speak, at the end, or why is my spirometer not ending the session for me? All we have to do is look at our session quality grade, and it's going to tell us exactly where we're at. So for an example, to get a letter A grade, we have to have 3 or more acceptable maneuvers with repeatability within 1.5 liters from trial to trial. So again, we can click on that session quality at any time and get that breakdown. All right, this is not NDD's grading scale. This is what has been produced by ATS ERS with the 2019 new spirometry standards. All right. Okay, I am going to flip a little bit here and pop over to EasyOne Connect. So I am going to get this synced here. So I am linked to my software right now through a Bluetooth connection. I know that we have some questions because with previous devices, we could do a hard cable connect to be able to utilize testing in EasyOne Connect. With EasyOne Air, that's not the case. We can use a hard connection, that micro USB cord, to export data from the device into EasyOne Connect, but to actually view a test or to perform a test through EasyOne Connect with the Air, it does have to be that Bluetooth connection. And I'm really only showing you guys this just so that you can see what this screen that is almost impossible not to get a glare, what it looks like on the larger screen. All right. So I am going to go ahead and select myself as a patient again. All right. Just swapping the test now over to here. All right, it's just asking me to block the flow tube again because I've swapped applications. And just like on the test, or excuse me, on the device itself, after it does that quick self-check, it's going to tell me to start the test. So again, teeth on top, tongue on bottom, big deep breath in, blast it out as hard and as fast as you can to the point of expiratory plateau. Awesome. All right, again, excuse the slight delay. It is just because I have it digitally connected here. I've done a couple of other tests on this account this morning, just playing with it. But you'll see there's the test. That trial 2 is the one that I actually did on the device itself a moment ago. And then here is trial 3 that I just performed. Just like on your EasyOne Air device, when you click on that smiley face, here's that screen a little bit larger. It's going to show us that pass-fail criteria, show us exactly what we need to do to improve for the next test. Just like if we were to click data on our EasyOne Air device to view the session quality, we can see the session quality here in the middle of the screen. So right now I have a B grade for both FEV1 and FVC, and then there's the variability right next to that. The system interpretation does show a mild obstruction. Again, I do have asthma, so most days it does show that mild obstruction for me. Just like if you were to click the data screen on your EasyOne Air, I can come and I can view all the different trials data. All right. All right. I am going to go ahead and stop sharing that one more time, and I'm actually going to finish the trial here on the Air device. All right, so I'm adding another trial here on the device. All right, it's giving me the prompt to blast out. All right, so I have 3 acceptable, reproducible trials. Sorry, trying to get the glare there. My session quality grade for both FEV1 and FVC is a letter A grade, and it is telling me that the session is complete. Again, I have the option to view the data or to end the test. So I'm going to click on End Test. And I apologize because one of my earbuds fell out. Let me put that back in. Getting too wild with my spirometry here. All right, so when we get to this results screen, when it tells us that the session is complete, you'll see that it has all of the best values here on this data chart. Down below, it does have that system interpretation of a mild obstruction. And then on the other side, it does have our session quality grade showing a letter A for both FEV1 and FVC. All right, if I want to view all trials, excuse me, while I'm mirroring myself here, you can click on the data to expand out to see all the different trials that we performed in today's session. And then you can click it to go back. The same with the graph, you can click to make that larger. And then the session quality, you can click to see that detailed breakdown of that letter grade, like what the variability is between those trials. All right. If you are printing directly from your EasyOne Air device, so you are not utilizing your computer at all, this is completely standalone, which I know is what so many of you do. From this screen, from the results screen, we would pop out our single patient use mouthpiece and throw that away. And then we would take it to the dock that is connected to our printer. Once that is docked, I'm trying to get it to where the angle is right. All we would need to do is to click that print icon, and it would print our report per our specifications or our, our preferences that we selected in the device. It would print directly from the EasyOne Air. All right, and then you would be done. As soon as you have that printed, get the angle right, you can click on finish, and then it would take you back to the EasyOne Air home screen. So I'm going to go ahead. I just sent my imaginary printout to the printer, so I'm going to go ahead and click finish. If you are using EasyOne Connect for your reports, so the software I was just in is available as a free download from our website. You just need the serial number of your device and to fill out a quick form about where the device is. If you do download the software from the website, some of the reasons you might want to do that is if you want to have your report altered in any way. Within EasyOne Connect, we really can select exactly what parameters we're seeing on the printout. We can rearrange them, we can reorder them a little bit, we can highlight abnormal results, different things that are a little bit more custom. Again, the report that comes off of the EasyOne Air completely meets standard. But sometimes if you do want a more customized solution, or let's say you're not using paper printouts at all, you want to save the test as a PDF, you need to export it into your EMR, then you would want to utilize the EasyOne Connect software. So from the EasyOne Connect home screen, so we would launch EasyOne Connect on our computer. We would dock the EasyOne Air, making sure that it has been returned to the home screen. That is very important. Make sure that it is on the home screen. Down in the lower right-hand corner of your EasyOne Connect screen, you'll see that there is a little picture of the EasyOne Air. Yours would have a USB connection in the middle. Mine right now is connected via Bluetooth, but if you have that cord connected to your computer, it would have the USB icon in the middle. Once you click on that, you'll notice that it is synchronizing with the EasyOne Air, pulling all of that patient data over, so that when we go to click on patients, now we can see all of the different tests that all of the different patients that I just pulled over from my EasyOne Air. And I have far too many Jamie Burgess accounts within EasyOne Air. So I'm just going to pick one of my Jamie Burgess accounts, and I am going to click on the patient history. I think it's the right one. It is. Excellent. So there is that 1219 test that I just performed on the EasyOne Air device. I can choose to view the data. So here's that test that I just did, or I can just choose to go straight to the report. EasyOne Connect does have several different built-in report formats. You can kind of toggle between those up here in the drop-down in the upper left-hand corner.
Jamie,
yes?
I'm sorry to interrupt. Are you meaning to share your screen right now?
I might be. Give me just a moment.
Sure.
I told you guys, EasyOne Air, I'm switching screens all the time. So thank you. All right, let me then make sure. All right, Joy, can you see my screen now? Because I'm just going to backtrack a little bit so they can see how I got here.
Sure. Okay. Yeah, it's there.
Awesome. I'm going to go back to the main menu, guys. So I docked my EasyOne Air and it's on the home screen. I can see that the EasyOne Air picture is down here in the lower right-hand corner. I can click on that and it's going to synchronize and pull the data over from the device itself. All right, now it is showing down here that EasyOne Air 1111509 is connected. I can go into my patients, see all of the different patients that it pulled from EasyOne Air, select the patient that I'm wanting to look at, and then I can go to view their history. Here is that test, that 1219 test that I just performed. I can click to either view the data or go straight to the report. All right, so again, within EasyOne Connect, we can rearrange our parameters a little bit. We can add parameters, subtract parameters. The overall standard report is going to look exactly the same from EasyOne Connect than it does printing directly from your EasyOne Air. They're going to look basically identical. You'll see in the upper left-hand corner, there are some standardized report templates that you can toggle back and forth and just see which one you and your provider prefer the most. So again, if you are connected directly to a printer from this PC where EasyOne Connect is installed, you can click that print button, or you can click on print menu to be able to export the file type in any of these formats to save on your computer. Most commonly, for an example, is to save it as a PDF file and then drag and drop it into your EMR. So again, there are some different options besides printing directly from the device and then scanning it wherever you need it to go. So I always kind of like to show both scenarios. All right. All right, I'm going to share my screen again, hopefully the right screen. Here we go. All right, so here is a little bit, here's a kind of a sample of what this, what the report directly from the EasyOne Air looks like. You'll see it there on the far right-hand side. It does look very similar to what I just showed you from EasyOne Connect. All right, we did talk a little bit about that session quality grading earlier, and we will see that session quality grading on our report, both for pre and post bronchodilator tests if you're utilizing that, but it's going to show up on our reports. So we've talked a lot about what makes an acceptable spirometry test. So I just want to highlight a few things really quickly before we go to questions. So what are some criteria that define an acceptable maneuver? And the first part is that explosive start. The whole reason why we teach to do the maneuver all on the mouthpiece. We want to make sure that there's no hesitation and there is a maximal effort from the patient right from the start. They take a big deep breath in and immediately blast it out and as hard and as fast as they can. Another thing is that glottic closure. We talked about the patient's posture in the beginning of the webinar, making sure that they're not bending over or crushing their neck down. We will see this in an abrupt flattening of that volume time curve or a straight drop down in our flow volume loop. This just means that there is an abrupt stop to that airflow in or after the first second of expiration. So we want to make sure that we're monitoring their posture, and that the next time we have them do the test, we expect them just to take that big breath, blast it out, and to keep blowing with our posture maintained. Another thing that is really common is when a patient coughs during a maneuver. A lot of times when we tell people to take the biggest breath possible, blast it out as hard and as fast as they can, it's going to cause them to cough a little bit. So we don't want to cough, especially in the first second, because it would affect that FEV1 parameter. So coughs are pretty easy to see on our device. You'll see those curves dip, and then you'll also be watching your patient and can see that they're coughing. Again, I never recommend deleting curves. There might be something useful in this curve that the software is going to pull out later. But again, you can give your patient a drink of water, you can let them relax, and then try it again once they're recovered. Extra breaths. So here's where those nose clips come in. So again, especially important for if you are doing the inspiratory side of the loop, if you're doing that FVL maneuver where we add a second deep breath in after we reach expiratory plateau. But we want to make sure patients can be kind of sneaky. They will be blasting out. They'll feel like they're out of air and they'll try to sneak a couple of extra breaths in. Obviously, we can see those, especially on that volume time curve. We'll see those start to kind of cloud shape up. So we do want to make sure that the patient understands this is one breath. We want you to breathe in and blast out all the way to empty, no extra breaths. All right, and one last time, just reinforcing the criteria for that repeatability. So not only does it need to be acceptable by standards, meeting those things that we just talked about, it also needs to be repeatable, meaning one trial looks like the next, And the rules for that for people over 6, repeatability for FVC and FEV1 is reached when the difference between the two largest FVC or FEV1 values is less than or equal to that 1.5 liters. All right, I am going to go ahead and stop sharing my screen here for just a moment. And we've come right about to that 10-minute remaining mark. So I do want to be respectful of everybody's time and make sure that we do have time to grab a few questions from the chat bar. So if you have had questions pop up and you haven't put them into the chat or the question tab on your toolbar, feel free to go ahead and do that. I think Joy or Bianca are going to hop on and we can start going through some of these questions.
Sure thing. Let's see. The first one, are the parameters and settings controlled via a password, or can any user easily adjust these settings on the device?
So we do have the option to enable like user controls on the device. So setting up single sign or not single sign-on, excuse me, user management controls on the device where we would go in and both in the software or on the device itself, where we would go in and make users create a username and password so that they would have to log into the device prior to performing a test. And along with that user control does come different privileges or different levels of control. So to answer your question, yes, default, anyone can go in and adjust settings. If you are needing to lock down your device for any reason, whether it's fear of settings getting adjusted or fear that the device will wander off your property and you don't want patient information to be accessed, you can absolutely set up those user controls. And that's something that both our Zurich support team or our US support team can help you guys set up.
Great. There's another question about printers, which I am going to go ahead and just add the application note in here and send it to
Oh,
all. So if
excellent.
anyone else has that question.
Excellent.
Next is, when do you enter the room temperature into the device for BTPS correction?
All right, so the device will only prompt you to enter it if you are doing an inspiratory maneuver on the air. So within EasyOne Connect, you can go in and set those, you can set those environmental factors, but on the Air device itself, and on the PC as well, it's only going to ever prompt you if you're doing an inspiratory maneuver, as in you are in training room air, where those correction factors might play a role. So if you're doing an FVL maneuver, it's going to prompt you to enter those environmental factors before each test. You will not see that screen by default when you're doing an FVC, because again, we're not in training room air, we're only blasting out. If you are a facility that needs to enter that information, a lot of people, there is a spot where you can handwrite that in on your report so that your physician can see those factors.
Great, thank you. Another question is, could you say more on the back extrapolation time and what it means and what is its importance?
Yes, actually, let me just pull that slide up. So BEV, that back extrapolation volume, it's kind of a tricky parameter and it gets into the weeds a little bit deep. So I'm actually going to just share this, to share my slide from earlier. Let's see here. Let's get back down here. All right. So this chart is actually, can you guys see my screen okay? I know I popped out of slideshow mode, but Joy, can you see it okay?
Yeah, I've got a bunch open. Yes, I can.
Okay, excellent. So down at the bottom of this, you can really see, and you can kind of see on the chart or on the graph as well, where it is zoomed in for that BEV value, that time zero of the forced expiratory time, where it starts, where the line is drawn at the same slope as that PEF or that peak expiratory flow, where that crosses the time axis. So the volume that was exhaled before that zero time is the back extrapolated value. And with the 2019 standard, this has to be less than 5% of our FVC or 0.1 liters, whichever is greater, which meaning the easiest way to say this is that there's no hesitation between the big breath in and the hard, fast, that peak expiratory flow, the highest point or the highest speed of flow. We don't want there to be any extra time that doesn't belong there. And again, this really is, grab a screenshot of this. This is kind of the best picture that I can offer, is this picture right over here that kind of shows that time where those two axes cross.
Great, thank you. And then another two that are fairly closely related, so I'll read them both.
Okay.
Does NDD spirometer require calibration? And can you explain how the calibration for this device works?
Of course. So I kind of breezed through it. I showed you guys where that calibration check is in the settings if you are a market that needs to do it. The short answer is no, you do not need to calibrate your NDD device. It is a point-to-point ultrasound sensor that is set in manufacturing. We have documentation to back up our no calibration claim, where we have looked at the stability of our devices in the field over multiple years and had that published. All of that being said, you cannot manually calibrate this device. It is, again, calibrated in production, but what we can do is verify calibration. We can do a calibration check, just verifying at any given day and time that the device is reading correctly. There are certain facilities that their biomed departments, like big hospitals, will require you to do a periodic calibration check. Again, just verifying that the device is functioning properly. And then there are also other market segments that will require it. The two primary being for research studies. Again, you never want your data to be called into question. You want to be able to show, no, this data is accurate because on the same day this patient was tested, the device was working exactly as needed. And the other is occupational health. Globally, occupational health in most countries, they require to have a calibration check on file any day that you're testing patients for the same reason. If you were to ever have to go to court, you would not want somebody to come and say, oh, well, how do we know that your device was functioning properly when you got this test? So again, while generally we do not recommend routine calibration check because we have shown that it is not necessary on our device. They stay in calibration. There are certain market segments or special situations where you may be required or highly encouraged to perform a calibration verification or a check with a 3-liter syringe. And we do have a really good video on our website underneath the resources and the videos tab that shows on the EasyOne Air and the EasyOne PC as well how to perform that multi-flow calibration check.
And I think this is the last one here to finish almost perfectly on time. If I have a patient who has done quite a few trials and they are not reproducible, I am assuming that I can opt to end the testing even though I do not have reproducible trials.
You absolutely can. So you can end the trial at any point. You can click on data, view your data, and the option to end the test is always going to be there. Again, in a perfect world, every single patient, knocks it out the first 3 trials. We're able to get that session quality complete and move on. But we know that that's not always the case for any number of reasons. Maybe the patient doesn't understand the test. Maybe they are that weak or that sick that they can't perform it. Maybe they do it fantastic the first time and then they could never catch back up to that point of reproducing that first trial. You can absolutely choose to end the trial. I would always leave a note for the physician or leave a comment on the test itself saying why you did that. But you can absolutely do that. Our spirometer is always going to take the best values from whatever trials you have. If all of those trials are yellow, it is still going to take the best values from the total amount of trials that you performed. And sometimes, as clinicians, that is a decision that we have to make is this patient going to give us a better result? Does this patient even understand what we're asking them to do? Those are questions that we have to answer as clinicians. So yes, you can elect to end your session at any time, knowing that the best values are going to be reported, even if they're not the most perfect values. Correct.
And I just have one more that snuck in here. I think we have time.
Sure.
If we have a 3-liter syringe already, is that okay to use with this device?
So 3-liter syringes. So we do have, because all mouthpieces are going to have different shapes. So you would want to confirm that you have the correct calibration adapter for that syringe. And this one will say that CalCheck adapter for the EasyOne flow tube, knowing that that is going to fit exactly on to your EasyOne flow tube mouthpiece. I don't have it in there straight, but that is going to click together and then attach to your syringe. Most syringe openings are pretty universal. There are a few older syringes out there that have more of a traffic cone shape that will not fit onto our adapter. One thing to consider if your syringe has been around for a little while, most syringe manufacturers do recommend periodic recalibration of the syringe itself, refreshing the lubrication, making sure that there's no cracks, or replacing the bellow or the plunger. So you want to make sure that that calibration syringe is within compliance or within calibration with the manufacturer. NDD syringes are manufactured by Hans Rudolph, and they do recommend that those go in for recalibration services once a year. So Yes, that's kind of a yes and no. We'll want to make sure that we have the correct adapter to the syringe and that it does fit on your syringe. And then also just double checking that it is working correctly by double checking that manufacturer's recommendation of how often it should be going in to be serviced.
Great. And I think that about covers our questions for today. Thank you, Jamie.
Awesome. Yeah. Well, and thank you guys so much for joining. Keep an eye on our website and with our emails. We're kind of relaunching this live training. I want to try to make sure that we're hitting different time zones that are, that work for everyone globally. So keep an eye out for upcoming sessions. We are going to start rotating in a couple of our other 2 devices starting in January. So about every 3 months or so, we'll be cycled back around to the EasyOne Air. So just keep an eye on our website, on your email for upcoming sessions. Anybody registered for this webinar today, whether they attended or not, will get the full recording of the webinar in their email from GoToWebinar tomorrow, so you can review and share with staff as needed. There is also access to all of our past live training webinars on the website under that live training tab, so you can access those at any time. Have a fantastic day. Happy holidays to everyone. I hope that you have time carved to spend with some family and friends and just really enjoy the season. And we will see you again for another live training session in January. So thank you all so much. Have a great day.
Thank you, Jamie.
Thank you.
Bye-bye.
Bye.